Welcome to all our Support Fibromyalgia friends. This is a very special broadcast with a very special chronic illness advocate. We want to welcome Latoya from Butterfly Chats today. She is a chronic illness advocate who will be sharing more about her health journey and how she was inspired to start Butterfly Chats. So welcome, Latoya. Welcome to all our fibromyalgia friends out there.
Hi, guys. Thank you so much for welcoming me here. I'm super excited to share with you guys today. So thank you. So excited to be here.
Well, we're excited to finally have an interview with you. I know we were supposed to do this last year, but there's a lot of things going on and to try to make it work. But I definitely have been waiting for this, and we have a lot of things to talk about too and introduce. And you're doing such an amazing work. I have no idea how you're getting it done with the podcast, the journaling, the books, and all the things that you're offering at Butterfly Chat. So let's kick it off with, I want to know more about your health journey, but I also want to know how this health journey inspired you to start Butterfly Chat. So maybe take us through like a little bit more on that.
Sure. Well, because like you said, I have fibromyalgia, and I've been chronically ill for now going on 10 years. So in the beginning, trying to find information about fibromyalgia was non-existent for the most part, not knowing what it was and things of that nature. So my goal, like over the years, and once I started kind of getting more comfortable in this fight, is trying to take the information that I'm learning and putting it in a place and delivering it back in a way to where people who are being newly diagnosed hopefully won't have to struggle as hard as I did to try to find information. Especially when you're newly diagnosed and you're trying to understand these big words, you're trying to understand what's going on with your body, and just trying to find information that you can digest to where you can take it and apply it to your life to try and get some semblance of a life back. That's the information I'm trying to put out there. So just living through that transition is what kind of got me here.
Well, and I appreciate you sharing and the vulnerability to the whole project itself and the journey. It is kind of always like this journey of optimization and what you go through and providing that support to the community that needs it. So that's why we're going to dive into some of the more of the details too on Butterfly Chats, because did you start with a podcast and then move to journaling and writing books and other projects, or did you kind of already know? How did you decide on where to start?
Well, it was kind of a back and forth. So I have been writing all my life in some form, whether it's just personal journaling, whether it's just doodling, whether it's just scribbling out little short stories just to pass the time. I've been doing that for a while. This one particular project that we're going to talk about here in a little bit, I've been working on that one for probably 15 years now. Writing some things here, fixing some things up, adding things to it, forgetting about it for years and going back to it. The podcast honestly started out as a necessity for me because of some neuropathy and some dexterity issues I was having with actually writing and journaling for myself. I started an audio journal is how the podcast kind of came about, because I was having a hard time writing, but I still needed to get these things out. So as I started collecting, the recordings, I'm like, well, I still kind of wish that I could write it down so that I could give the information to people, and I'm like, well, and as I was in the process of actually trying to transcribe my notes or my recordings, it was just kind of like an epiphany, like, duh, just post the recordings, child. And I'm like, then it just kind of like happened, organically, but piece by piece. I'm like, well, if I'm doing that, then it's kind of a podcast. I could make a thing of, make a thing out of it. And that's really kind of how it started.
Well, I like how it pieced together.
Yeah.
Sometimes I forget the differences that we need for things since I track a lot, but I tend to write things down on paper. But I remembered that people prefer sometimes to track or like voice to text, like stuff like those, like tools. So I like how you bring that up and integrated it to make it more useful for you and others.
Exactly.
And then you want to share this information with podcasting, and podcasting seems intimidating to like people like myself and other people, but you dove in. Like, what were things you were telling yourself in order to get started?
Oh, I was telling myself, you're nuts. Like, what exactly are you doing? Like, you have a chronic illness. You work a job that, is stressful. You have a family that's very demanding. Like, you have new diagnoses that are chasing you down. What are we doing? And then, like you said, once I realized I was actually getting into a niche, a thing, and then my researcher brain took over, because once I decide to do something, I'm one of those people that if I'm going to do it, I'm going to do it to the best of my ability. I'm going to research it, figure out what I actually need, how it actually is supposed to be done. So on top of just gathering my thoughts, I'm also learning how to do a podcast, like what a podcast is. So yes, it was very intimidating. Even to this day, it's intimidating. Just fighting that self-doubt of, like, am I really doing this like for the people, or is anybody even listening? Like, why am I doing this? But I can tell from the numbers, and I can tell that people are listening. And for me, it's not even about big numbers. I just want people to get the information. I don't care if it's just one person. That's fine. That's fine for me. But trying to get over that initial, nervousness of you're taking on yet another thing, even though your body is just screaming for rest. But ironically, once I got into it, I actually found it relaxing. So it's kind of odd how those two things happen, because it is a lot of work. It's a lot of planning. It's a lot of, small parts behind the scene that have to work together. It's very technical. It's very technical. And with brain fog, that's you asking for trouble. But yeah, it works out, and it's working out. So, I'm of the mindset and of the faith that if as long as it's falling together, and as long as I'm able to do it, I'm going to keep doing it.
That's fantastic. Well, I mean, it's so interesting too, how your mind was trying to say no, like, but create so much doubt. And then you move forward, and now you are able to help and share with other people, and you're noticing people gravitating towards you and everything that you're sharing. It's really picking up a lot of steam. And then you found your flow. So you're finding some flow and relaxation within doing it, which is amazing in the production scene, because you can kind of get into flow with production. So that's a fantastic like project to understand and a campaign to launch. So we want to make sure that all our support fibromyalgia friends do go and support you.
Please.
We'll definitely include all the links in the description when this video is posted for everyone to go find you and support you and follow you on social media. But on top of the podcast and being impressed with that, you also created a journal, right? So
I did.
Can you tell us a little bit more about that? Because that's not production. Well, it's production, but now you're publishing.
I know. And this is in addition to the other project that I was telling you about earlier. I know. I don't know where these things come out. They just pop out. I don't know. So it's once I get into a creative flow, it just happens like that. So I'm working on my book of poems, and I'm working on the graphics for that. And as I'm testing things here and testing things there, I'm realizing that I actually need to kind of organize myself, because there are a lot of moving parts. I mean, there's just a lot of parts between my chronic life, my work life, my family life, the podcast, scheduling interviews, and just all the things. So I needed a journal that I could use for myself to keep me calm, keep me centered, keep me focused, and to keep me from kind of going off on my tangents, because I can veer off. And so I started using this template book, and then I started pulling little pieces from here and there to kind of make this one book that helped me kind of keep my brain going in the right direction. And I'm using this, from day to day. And then when those negative thoughts come, and I'm like, you know what, you're tired, you're doing too much, stop doing that thing you love, and I'm like, wait a minute, as I'm journaling and using those prompts that are in this journal, that helps me to snap my brain out of that negative mindset. And it brings me back to the present moment. And again, so as I'm using this as for myself to keep myself sane, I'm like, okay, well, and I guess that's just my nature. I love to share. I'm a sharer, and I'm like, this is actually working for me. It's keeping me where I need to be. It's keeping me to where I feel okay. And I'm working in with mindfulness and with yoga and whatnot. So once I realized it was working for me, I was like, well, maybe someone else would like it. And so that's what made me want to come out with the book, with the journal, the Butterfly Mindfulness Journal. It's just a simple, cute little book that, even for beginners who are in mindfulness meditation, and I made it kind of cute and kitty, kind of on purpose, because it could be for teens, preteens, to kind of start them in that flow of being in the present moment, get them off their devices, and keep them, in that present moment. It has mental and emotional prompts to kind of, get you where you need to go. And it's a good scheduler. It has gratitude pages, and it's good for about good 6 months if you really kind of do it each day. So I just kind of figured it's just a cute little book to throw out there and just see, how many people can find, the kind of calm and focus that I found while I was using it.
I love the creativity that you can share with the community. And I did order my copies. It'll be on its way, I think, in the next couple of days. So I'll have to take pictures and share with everyone
Awesome.
on the Support Fibromyalgia Network. So stay tuned for that. But
Yes.
I always enjoy hearing from people that can share their creativity with others on what they actually do to help themselves, and then be able to replicate it where it's attainable for other people to use. I struggle with this because everyone's like always asking me, what do you do? And then when I share, I guess it's very complicated. So it's not very easily translated. So when you're talking about mindfulness and journaling and just being a creative person and getting into this creative space, it's so helpful and it's such a healing process. So I'm glad you're able to translate it in a tangible way that other advocates can pick up and enjoy and connect with. And are you finding it very fulfilling to have people reach out to you at this point in time and be like, wow, this resonated with me?
It is very fulfilling. It's also very, yes, I'm naturally a very private and humble person. It's almost kind of like, it kind of gives that shyness comes out of me. I'm like, oh, it's not that big a deal, but then I have to also, take a step back and then just realize that, for that I am actually helping the community, and that's my purpose. That's why I do all the work. So I stay up the late nights, and I am very happy that people are actually connecting with it, because it was a lot of work, and I do want to be an asset to the community. So it does make me feel good to have that feedback, for people actually being, kind of confirming for me that it was a good idea.
Well, I'm glad, and we'll definitely keep sharing the projects and the new podcasts. I know it's been
Yes.
nice, I'm sure, to have a podcast too, because you get to connect with other advocates and ask
That's
them
been the best
questions.
part. Yeah. And
Any
that's been the best part, really.
Well, and then you've been sharing podcasts too on tidbits and advice. So, I mean, where does that come from, and how do you select what makes it onto the podcast or not?
Um, it really kind of comes from what I'm hearing from other members of the community, people in my support group and in my circle, the things that we're struggling with, which is basically the same things you're struggling with and everybody else are, daily stressors, how to save money, but in our situations, you know, saving money or getting an extra job or doing the things that most other people who are not chronically ill would do or could do, is a little bit to a lot more difficult for us. So having those ideas, that I can share with the community, to be like, well, yes, you have to modify a lot of things. A lot of things have to be modified, but just giving the community those ideas of using apps and asking for help, which is the hardest part. And just kind of taking the conversations that I'm a part of and that I'm hearing, and then finding that information and giving it back out, in the pieces, in the importance pieces, like in the important segments, where the apps are, how to use the apps. What do you say once you get in the store, and you're in front of the manager, what do you say then to try to get that discount? It's just kind of, taking bits and pieces of things I've heard in life and giving it back out there in those small segments.
Well, and we've had a lot of conversations together on filling in pieces or how do we give information in the most concise way or direct people to resources as easy as we can, which kind of leads me into the next question that we generally ask our advocates or organizations when we do interviews is about community needs. So as a chronic illness advocate, are there programs that you feel need improvement, or is there something missing that you would like to see changes to when it comes to these like community type programs?
Well, yeah, yes. I mean, I think we all can probably agree that in general, there's a lot of programs that are out there that, as far as, food insecurity, utility assistance, just general home health, household assistance types programs that, you have to be basically nursing home or hospital level sick, to even begin to qualify for those programs. And, I mean, and the sad part is, if everyone in the chronic illness community were at that level to qualify for those programs, we still wouldn't have enough facilities to care for all the people. So it's like we still have to try to fight and stay up on our feet. We still need the help. So having an expanded programs for food security, to have for the rural areas, maybe expand, the home health insurance area where the insurance qualifications can change, or just have either some other type of community program that is available for people with chronic illness that specifically services that community, because our community is so specific in the need that we have. Because a lot of us, yeah, we're up, we can move around, but that doesn't mean we don't still need the assistance to kind of make our days better and easier. So programs like that, that can just make, our general living situations a little bit easier.
And I know we are going to continue having conversations like this because It's interesting with the diagnosis of fibromyalgia too. I think I hear a lot that people don't realize that they qualify or what they qualify for. So I know there's a lot of confusion, but when we initially started talking to each other too, you were mentioning home health aides and different things, or just utilizing tools that maybe we're not using that might be helpful, like
Mhm.
just a chair in the shower
Yep.
for those days. You don't have to use it every single day if you don't feel
Yep.
like it, but at least it's an option that's
There.
there. So, I mean, that's what it's, these conversations are super important. That's why I
Mhm.
value you jumping to a podcast and then sharing these on your podcast and working from home. I know you have a lot of tips from that.
Oh yeah.
So, just
Yeah.
sharing it and letting people know, like, okay, you can not only try to get this, which is a process in itself, but it's like you do qualify. This isn't something that it makes you disqualified for. And like,
Mhm.
this is what it's designed for.
Yep.
So, do you have any,
Yeah.
like, I guess maybe it's just encouraging words for people that kind of doubt themselves, like, oh, this isn't meant for me, or all this stuff?
Yeah, I mean, I can tell you the words that I tell myself almost every day. Um, a lot of times, well, I can speak for myself in this situation where for me, um, it was pride, pride that was keeping me from even asking the questions in the beginning, and pride even for me admitting that I had the need, knowing that my legs felt like noodles, but yet I'm still standing strong and tall about to pass out. Not wanting to admit that I had something going on. So, firstly, I would just encourage you to not hide it, because hiding it, pushing through is one thing, but enduring suffering is something else. And the longer you stay in that forceful fight or flight state, the worse it's going to get. It honestly won't get better until you ask for help. And asking for help is not the worst thing in the world. It is not a sign of weakness. It is not all of the things that you may have been told whenever you were told them. Asking for help is a human need. And if we were meant to be on our own, we would be on our own separate island. I know everybody's heard that saying many times, and it's very true. If we were meant to be by ourselves, we wouldn't be together. So let someone know, because you don't ever really know what kind of life you could have and what kind of support you could get until you let someone know that you need it. And it's gonna be better as soon as you allow it to be better.
It's really strong advice and something I wish I had learned early on, and
Me
especially
too.
for understanding disabilities in itself and know what we like can earn. Like, these programs are designed to help us, but we
Mhm.
have to be accepting to take it. And it's really hard because, I mean, from my past journey, I didn't know, I was so resistant to maybe using mobility devices on college campus. But had I been able to do that, and I know there's a process, sometimes there's going to be a lot of hurdles, even if you
Mhm.
accept it.
Yeah.
But I mean, I might have been able to get to classes easier and gone and
Mhm.
followed through with my dreams of what I wanted to do. So
Yeah.
it's,
And it's hard. It is very hard. I mean, I can't tell you the amount of times that, even like when I'm out grocery shopping for my family, knowing I needed the little motorized carts, and the times that I've fainted in a Walmart or in a parking lot because I just didn't want anyone to see me as weak, or see me, or thinking, or even thinking that they were, thinking derogatorily about me. And even if they were, who cares? Like, it's like after you pass out a few times in public, you kind of get over that. And you just have to realize, like, it's not the worst thing in the world. Um, and for me, and I'm sure anyone else who even has done the same journeys I've done, like me asking for the help from the WRC, which is the company that I'm using to help me work at home. It's the Wiregrass Rehab Center. um, asking for help through them was like by far the best decision I had ever made. And yes, I thought I would not qualify. But I did. All I had to do was have some sort of medical diagnosis, period. And that was it. They asked no questions. They didn't do anything else. And if I had not have done that, I would not be able to work from home. I would not be able to take care of my family. I would not have the confidence that I'm having now. Because before it was bad. It was bad. The depression was bad. And, I was just in a very not good place. So that's why I'm just so passionate about letting people know that those programs are out there. They're called different things in different states. Just basically just go to a rehab center in your area and just ask them for adult rehab services and see what they have out there. Because they help. They help.
Oh, they definitely do. And just knowing that that's a resource that we can go to is important, because I wasn't really aware. I never knew to ask about those things.
Mm-hmm.
I mean, and they're available. They, and again, they may not be perfect.
Yeah.
But I mean, they sound like it's dialed in. They didn't question anything, which is great. We love that.
Exactly.
And that's an advantage, because people want to be able to work and do stuff from home if that's the best thing, or even accommodations at work.
Oh, yeah.
It's available to us. We, like you said, we have to challenge ourselves and be brave enough to like
And
ask.
it's hard. It's hard. Even today, I don't think like, this is confident, this is smiley, and this is me. But yes, I have to talk myself into a lot of things every day. Because I have to fight that brain fog, that self-doubt constantly, because it's a real thing, and it's like, am I doing the right thing? Does it even matter if I'm doing this? Anything of that nature. So yeah, self-doubt is gonna come, but when it comes to your health, you really, especially when it's chronic health, when it's chronic, you have got to fight for yourself like you have never fought for, like, and that's something I didn't realize. I knew I was stubborn, I knew I was determined, but when it came down to my life, like it brings things out of you. And sometimes that's what it takes. You just really got to be willing to go to the mat for yourself.
Thank you so much for opening up and sharing a lot of this, because it's you have such good resources to share and so much strength to share. And this is an important piece of the Support Fibromyalgia puzzle, is bringing this community together. So we hear from different advocates and the work they're doing, their experience, and then they can share the resources with the community. So the community knows, especially the fibromyalgia community, that you're not alone. And there are people that care. There are people that you can reach out to that have similar experiences and information to share. So, I appreciate this so much, Latoya.
You're very welcome.
Now I'm going to put you on the spot a little bit, because as an advocate, you joined us for our virtual advocacy day last year in May.
Yeah.
It was our first time doing virtual advocacy day, but I love it so much. We're going to do it again. But as doing this virtual Hill Day, where this was your first time, I don't remember if it was your first time talking with the representatives.
Mm-hmm.
Do you have any pointers out there for people that, may want to join, but are hesitant to join? And
well, I would definitely, research, your area, so that what laws are out there that are coming up that you want to petition, or what you're asking for. You're going to learn the lingo. the lingo is good too. Just so that you can, just so you can be up on it. And for me, scheduling breaks in between your meetings is the best thing because it's so high energy. It is so high energy. I absolutely loved it. I was nervous because I'd never done anything like that, and having what you're going to say written out, and especially if you're doing virtual, it's convenient to have it up on your screen, have it written out, have it up on the screen, because you're nervous, you're going to be tired, and you're going to have brain fog. It's going to happen right when you're talking to the person, to the representative, and so you want to try to sound as coherent as possible. So I would definitely have that written down. Schedule your breaks in between, and then just have fun, because that was really just like that was. Yes, we were on Capitol Hill, trying to get things done, but the atmosphere of just everyone together was just fun. Everybody was laughing. It was just a light, friendly family type of feeling, and I loved it. I had a great time.
That's awesome. I'm glad you guys are having fun. So I'm always the nervous, like behind the scenes. But I'm just glad that you share, and this is what it's important. We hear from all of you. What do we need to improve? What do we take away from it as we add more people in for training? Because we just feel that it's important to connect with your representatives, whether you want to move from fibromyalgia advocacy to doing other local advocacy work. It's just good practice, because we're talking about food insecurity and other bills coming down the pipeline. So how do we get more advocates empowered in their local community too?
Exactly. And I think it's just basically, for me, it's just getting out there and knowing that there is a need out there. And then because for me, I wouldn't know how to start. Learning from you guys and seeing how you guys did advocacy day, even the year before when you guys went out there, actually, and just seeing how organized it was, and learning about each of the representatives and each of the different, laws and things that we were going to talk about, having that outline is what helped me kind of get my thoughts together. And when it comes down to, spreading that and getting more people involved, I think, just getting out there, letting people know that, hey, advocacy is a big deal, but if you take it in smaller chunks, and if you take it, with a group of people who are of the same mind, it can be done piece by piece. And I think if you just kind of, let people know that it's out there, give them an outline, I think they'll fall in line. They'll come.
Perfect. I mean, those are the steps we're taking. We're still doing virtual advocacy. I know in person at Capitol Hill takes much more energy from us, because we have to get to the airport, fly in a plane if you are out of state, and that takes a lot of work. And then
the stairs,
walking around,
the stairs.
It's a really good experience. A lot of us learn. It was good to be in person, because then you get to be with everyone, and then you're there. But we know the energy capacity it takes. So I think we'll slowly move from, always doing virtual. I think we'll do a hybrid event continuously, but having that virtual training and that virtual stop first, and then move on if people are able to go to Capitol Hill as everything opens up. Will be our goal.
I think so. At least for me, I'm probably going to use the virtual, and in the meantime, kind of be working towards going in person, because I'm looking at when you guys were in person, and the Lord knows I wanted to be there, but it's like I can tell, just the physical toll. I mean, you just got to think about it. I mean, it'll be a lot for anybody, but we talking about chronic illness and body aches and all the other things. It's like, yes, a lot. But you're doing it for a good purpose. So it's you have to kind of take that into effect as well. So I love it. And I'm just so, I am thankful and positive that it's going to work out, that all the work is going to show out, and we're going to actually get some results soon.
Well, we're starting to see some unusual activity in the investment. So I think
Okay.
some of this is actually working. We just needed to go. We needed to show up and talk to them. And we've had good experiences so far. For the most part, everyone has been willing to listen to their constituents because they know it's important. And we've talked to them and shared, and they're like, yeah, I don't know why your budgets are so low with the amount of people being diagnosed. So they're getting it.
Yeah.
We got it, and we're learning from each other, and we're a community coming together. And like you said, it's not even just the legislation part, but it's having fun together as a community, doing something together that we can do and bring everybody from different states.
Yes.
We're all over the country, and we're coming together for these events. So that's really, I'm enjoying meeting a lot of different people.
Yeah.
So you're representing, do you mind telling us what state you're representing?
Yeah. Alabama. I'm in Alabama. Trying to get it, spread it down here.
Yeah, so we want to try. We've had some constituents from Alabama before, so we invite other people from Alabama.
Please.
You'll be joining Latoya on these meetings and expanding, and she can help you learn the ropes too. Now,
come on in, come on. It's plenty of room for everyone.
It is a community, and that's what we really love to emphasize, and that's what we appreciate too with the Butterfly Chats community, and just how much you're inviting people in and sharing and being better community advocates to each other, not only the advocates, but the new members that join and stuff like that. So I really appreciate all the work that you're doing.
Thank you. I appreciate that. I appreciate the recognition.
As we close out this interview, where can our Support Fibromyalgia friends connect with you on social media?
So yeah, you can reach me at, you can either send me an email at spoonysupport@butterflychats.com, or you can go to butterflychats.com, www.butterflychats.com, and you can just fill out the contact form on the webpage, and I'll get back to you as soon as I can. Or you can reach me on Instagram. It is butterflychats/fibroflash, and you can send me a message there.
Okay, fantastic. And then, of course, subscribe to the podcast.
Of course, Butterfly Chats, the podcast, anywhere you get your podcasts.
Fantastic. And we'll include all those links in our description so you can connect with Latoya. You're going to be seeing much more of her as we are working on projects together in social media. She's teaching me a lot about reels. Although I need to get comfortable because I think I missed duets with you.
It's okay. We'll work on it. We'll figure it out.
It's hard. Again, it's mindset, right? Because I'm like, do I look okay? I'm in my pajamas. Like, do I go on social media in my pajamas?
Yes, absolutely. Absolutely.
It's like my hair never works. Do I have to like do stuff? The lighting, but sometimes the lighting does matter because I'm on the camera and I'm like, you can't see me.
Can't see you. Exactly. Yeah, the lighting does, a ring light might help. I was like, yes. Or direct sunlight, but yeah.
So to all our friends out there, stay tuned for more social media crossovers with Butterfly Chats and Latoya all over social media. We want to build that community and of course showcase that you are not alone. There's a lot of advocates you can connect with that can share their experiences with you as well. So thank you to all our Support Fibromyalgia friends for tuning in. I am Melissa Tovar. I am the Executive Director of the Support Fibromyalgia Network, and I'm also a board certified health coach. Stay tuned for our upcoming interviews, and we'll be back soon. Thanks so much, Latoya.
Thank you. Bye, guys.